I'm going to share 8 tips to beating nausea and vomiting during pregnancy. For some women, morning sickness is one of the first signs that you're pregnant, and this can be pretty difficult. The good news is that it should be completely gone by the second trimester, which is week 13 of pregnancy. The exact cause is still being debated and studied, but it's likely that hormone changes in pregnancy are a major factor. The first tip is to change your eating habits. Eat small, frequent meals, and this is going to help quite a bit. You don't want to go a long time without eating, and you also don't want to eat a large amount all at once. Eating often and in small portions is best. It's not the same as the nausea and vomiting after food poisoning or a GI virus where you don't want to really eat at all. You want to eat very often. Eating a high protein diet can help also. This is more effective in controlling your symptoms than eating many carbs. Having a snack by your bed if your nausea is first thing in the morning can really help. Tip number 2 is to avoid triggers. Avoid any foods that sound or taste gross to you. Avoid any gross smells. Other triggers can be heat or loud sounds, even flashing lights or different motions. My triggers were heat and humidity, and this very specific body wash scent that my husband wore all the time. Thankfully, he changed soaps and I was a lot happier. Common foods that are triggers are spicy, acidic, and high-fat foods. So spicy is pretty self-explanatory. Acidic foods could be tomato-based foods, and then high-fat foods. Tip number 3 is to drink lots of water. In pregnancy, your water needs increase quite a bit. Getting behind on your daily water amount can make your nausea much worse. Drink enough water to make your urine light yellow or clear, and that's a pretty good gauge that you're drinking enough. Tip number 4 is to get rest. It's definitely easier said than done, but not sleeping well or adding more stress in your life can actually worsen your nausea. Work towards a good sleep routine. That means stop using screens an hour before bed to help your brain kind of wind down for the night. Make your room completely dark, a little bit cool, and as comfortable as possible. Take out any TV that's in your bedroom. Even when TVs are turned off, they've been shown to interfere with good quality sleep when they're in your bedroom. Journaling or reading before bed can help your brain wind down and prepare for sleep also. Really, it's important just to do what helps you get good sleep. Next, we'll talk about a few easy over-the-counter medicines or supplements that can help nausea in pregnancy. The first is ginger. You can have this in tea or candies. If you don't like the taste of ginger, some women say that the smell of ginger helps them. Ginger or even peppermint in a diffuser can really help some women's nausea. You'll likely be surprised at the next supplement, as I was when I first learned this tip. But first, if you're finding this helpful, it would help a lot if you'd like and consider subscribing for good health tips. So vitamin B6 is the first supplement to try. This has good evidence for decreasing nausea in pregnancy, and it's just a vitamin. You can take vitamin B6 25 milligrams 1 to 3 times per day as you need it. You can buy this over the counter in tablet or gummy forms, whichever helps you more. The next supplement is doxalamine. It's marketed as a sleep aid, so I say try it at bedtime once and see how it helps you. You can add this to your vitamin B6 and it can give you more relief from your nausea. There is a prescription combination of vitamin B6 and doxalamine, but it's pretty pricey. There are prescription options that your doctor can prescribe you if the lifestyle changes and the over-the-counter options aren't helping your nausea. These are Zofran, Reglan, Compazine, and even oral steroids. It's important to note that some studies of Zofran have shown a possible risk of cardiac issues in babies whose mothers took those during pregnancies, and then other studies didn't show that risk. Overall, it's always wise to talk to your specific doctor and get help early on so that you don't develop more serious complications such as hyperemesis gravidarum, where you're starting to lose weight and you're getting behind on your calories and your water intake. I hope these tips help you take control of your first trimester nausea and vomiting.